this kind of discussion we are having is going to define the way our patients will go to interact with the system. Either it will be with micro services, so multiple apps in our smartphones. One will read our cardiac signs, the other one will talk with our kids, the other one will be used to diagnose our cervical cancer, or we will have huge marketplaces that will centralize our personal data and our health data.
Yes, there are some big players on the planet who have all of the data. It will be the government with the private companies. Both of them have to help in this impact and help and make this data used well and utilize it well to improve the healthcare system or ecosystem in the different countries.
So private-public partnerships is something which is really needed. It cannot be done alone from the private part or from the public part.
Another element I like to touch upon is that I really like the initiative that is currently been taken on a European level, where we try to collaborate within a think tank approach to see how we can use data safely in secondary purposes.
I think that we need to have the healthcare providers with us on this journey towards the empowerment of the patient.
The key factor here is also access. I mean, how do you build and think about solutions that can be implemented in the poorest regions of the world, and not only for the people that have a good access to?
We are all basically part of the same ecosystem, and in this part of digital transition, we must stop working in a fragmented way, and we must understand how we can combine our solutions in a swift manner, and a manner that is not constrained by too much regulation, and that when we combine our solutions, how can we use that, our combined forces, to increase our impact?
At the very high level that we're on here, seeing all your products and how great they are and how they work with the devices, I can only tell you, I don't even know in Austria, in Vienna, how I'm going about training my staff to be able to use that.
We strongly believe that the skill set to use this technology is different from the skill set that traditional health workers have. It's completely different. So it's kind of what we are planning, and we strongly believe is that we need a new profession. It's like a technical intel health that knows technology and is able to turn on and off the devices and know how to use the camera and has the ability to use the apps, and he will help the doctors and nurses, because this is a big challenge and it's a whole new world.
I don't think it's going to be a physical person. I think it's going to be a digital assistant, and I think that's part of the solution. So it's not just about empowering patients, it's just about to empower the healthcare professionals that are around those patients.